Beets are one of the few vegetables that contain betaine. This powerful antioxidant fights cell damage and reduces the risk of heart disease. Beets are rich in fiber, potassium, vitamin C, iron and folic acid. These nutrients help regulate blood pressure, reduce inflammation, and improve overall health. Beetroot is one of the most affordable vegetables, which is unpretentious in storage and cooking. Adding beets to your diet is easy, and you can eat them every day if you want, but not for everyone. Let's figure out what the benefits of beets are and when you should be careful when introducing this root vegetable into the menu. Beetroot is a large root crop of the Amaranthaceae family. They are similar to turnips and radishes, although the plants are not botanically related. There are several varieties of beets, including fodder and wild, but the most common in cooking is the one with a rich ruby red color. Native to the Mediterranean, beets are easy to grow and today are cultivated throughout the world. All parts of beets are edible, from the root to the leaves. The latter were especially valued by the Greeks, Romans and Egyptians for their medicinal properties. Beet roots are eaten boiled, fried or raw, alone or in combination with any vegetables and meat. It is also used as a natural dye and for making juices. Beets are a low-calorie product that consists of almost 90% water. In addition, it contains such important elements as betaine is what beets owe their rich red color to. This natural plant pigment has antioxidant and anti-inflammatory properties. It also reduces the risk of developing vascular diseases and improves performance. Folate, potassium, magnesium and vitamin C. Folic acid plays a key role in the basic functions of the body's cells. Potassium maintains normal fluid levels, magnesium is responsible for bone and heart health, and vitamin C supports the immune system. Beets are one of the leaders in iodine content, which is important for people with iodine deficiency. It contains citric, oxalic, malic, tartaric and organic acids, and is also rich in fiber, including pectin, which affects the intestinal microbiota. Health benefits of beets. 5 facts. Regardless of which syllable in the word beet is emphasized, its benefits for the body remain unchanged. Here are some of the proven properties of this root vegetable. Lowers blood pressure. Beets contain dietary nitrates, which are converted into nitric oxide in the body. It relaxes and dilates blood vessels, reduces blood pressure and the risk of developing cardiovascular diseases. One study found that drinking 250 milliliters of beetroot juice daily for 4 weeks was sufficient to lower blood pressure in patients with hypertension. Other studies have linked beet consumption to a reduced risk of myocardial infarction. Affects intestinal function. The fiber and large amount of water in beets help the gastrointestinal tract function and prevent various disorders, including constipation. Due to its dietary fiber and low calorie count, beets can be included in balanced diets for weight loss. There are studies that fiber not only makes food easier to digest, but also reduces the production of hormones that cause hunger. Increases endurance. Drinking beet juice increases endurance and improves athletic performance, according to several studies. Scientists suggest that nitrates play a key role in this. For example, one placebo-controlled experiment showed that men who regularly drank beet juice were able to improve their performance on an exercise bike compared to the second group. In tests conducted on rodents, beet juice supplements increased blood flow to the extremities. Fights inflammation. Beets are a rich source of antioxidant compounds that protect cells from free radicals. The main role in this process is played by betaine in its composition. It has been shown to prevent or reduce progressive liver damage and preserve intestinal integrity and fat tissue function. A study in mice found that supplementing with beet juice for 28 days attenuated lipid and protein oxidation and DNA damage. Another study found that taking oral capsules made from beetroot extracts relieved inflammation and pain in patients with osteoarthritis. Improves brain function. Nitrates in beets help improve brain function by increasing blood flow. A study among a group of people with type 2 diabetes found that those who consumed 250 milliliters of beetroot juice daily for 2 weeks responded 4% faster during a cognitive function test compared to the control group. However, scientists admit that more research is still needed in this area. Who are beets contraindicated for? As with any food, frequent consumption of beets is not beneficial for everyone. The main risks are associated with oxalates, oxalic acid salts, that are present in its composition. This organic compound can cause negative effects in certain cases. Increased risk of kidney stones. Calcium oxalate stones are the most common type, followed by calcium phosphate stones and uric acid stones. Betaria is expressed in the coloring of urine pink or red. This is generally harmless and goes away as beet consumption decreases. The oxalate in beets can increase uric acid levels, which can worsen gout. Beets contain quite a lot of sugars. Per 100 grams of table beets there are up to 8 grams of mono and disaccharides. It can be classified as a food with a high glycemic index, so beets should be avoided by people with carbohydrate metabolism disorders, insulin resistance and diabetes. Due to its laxative effect, it is contraindicated in people with irritable bowel syndrome and those prone to diarrhea. Beets also increase the acidity level of gastric juice, so peptic ulcers, erosive disease, and hyperacidity would be a contraindication for consumption. Allergic reactions are also possible, especially if there is a history of hay fever. It is worth excluding the root vegetable from the diet during the flowering period, which causes an exacerbation of allergies. How to cook beets correctly. Beets have been used in cooking for centuries. It is added to hot and cold soups, salads, baked goods, pickled, or eaten raw as a snack. The optimal serving of beets is about 50 to 70 grams raw or 100 to 150 grams baked or boiled. How to cook beets correctly. To begin, the beets should be thoroughly washed from the soil under running water. Vegetables are placed in cold water in a pan so that they are completely covered with water. Beets are cooked for an average of 40 minutes to an hour, depending on the size of the tubers. You can check readiness by piercing the beets with a fork or knife, they should be soft. After draining the hot water, cool the beets. To do this, you can keep the tubers in cold water or wrap them in foil, and put them in the freezer for 10 minutes. Once the vegetable has cooled, it will be easier to peel it. Let's end the video here. On the channel you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as diseases and methods of treating them. Therefore, please do not forget to subscribe to the channel and click on the bell. I will also be grateful if you like and share the video with your family and friends. See you again.